Okay, like you take the ovary, you ship it out, it lives over here for a while, and then it comes back, and the arm? What is going on? This is amazing. And many of us would not think of kids and fertility preservation while they're undergoing treatment for other issues.
It's true. We have been very lucky, and I would say on the whole, Canada has been slow to adopt some of these procedures, but in the last 18 months, the whole country has really been working very hard to provide these services and access to these procedures for kids. And I think it's super exciting because it provides like hope for in the future that
Sure.
they're going to survive whatever they're going through and have the life that they envision for themselves.
Yeah, amazing. I'm so glad that we're doing that, and I'm so glad that you two ladies are so deeply involved in this project. Amazing. All right, can we talk? That was great information that you gave. And you know, you wanted us to see that slide with the mucus breaking down and being lame and all kinds of things going through it because we're eating white bread and Fruit Loops and everything like that. Okay, you've got me. Okay, I have pleaded ignorance, but now you've got me. This Mediterranean diet thing seems to be a thing. It's catching on a little bit for like hundreds of years. And the stats, the science shows that it may be the way to go. Very beneficial.
Yeah, absolutely. So I think one of the main things with the Mediterranean diet is the inflammation piece.
Yeah.
Because so many conditions and diseases that we face today have a root in inflammation. It either triggers the disease or it makes the disease worse. And so if we can adopt a dietary, an eating habit, an eating style that helps to reduce inflammation, at least some inflammation from the dietary standpoint, I think it's really important. And the foods that are in the Mediterranean diet, they're tasty too. So it's not just us doing something good for us, like there's tasty foods in the diet. So.
And while you're eating it, you're envisioning yourself on a balcony in Greece having a glass of wine with a nice, young, handsome waiter, and having fun like this. So you've given us a lot to think about with that one. All right, have we got some questions for any of the ladies? I see some hands at the back. Oh, there, right there. Go ahead. Go ahead, caller.
Okay. Hello.
Hi.
Hi, Dr. Reimer. Thank you for your presentation. I just had a few questions. The first one is what your thoughts are about like stevia extract or the fiber that they put in like Fiber One bars and like the pita breads. And then another question about antibiotics and affecting the microbiome and what your thoughts are about to like probiotics to help resolve that after.
Okay, I hope I can remember those three things as we go through here.
We'll start with the sweeteners and the added fiber. So fiber
Perfect.
that's not like sitting there, but you've
Yes.
injected it in.
Yeah. So first of all, with the stevia, so a lot of the research that's been done so far is on the artificial sweeteners. So aspartame, acesulfame, Splenda, but there is a very interesting piece of research that's now been done where they compare those artificial sweeteners together also at the same time with stevia, which is a natural low-calorie sweetener. And the interesting thing with that research is that they show that just like there are with artificial sweeteners, with the stevia there's responders and non-responders. And so there will be people who consume the stevia, the natural low-calorie sweetener, who will develop this glucose intolerance, this kind of pre-diabetes state. So is it safe? It's safe, yes, because it's on the market, but is it healthy for everyone? And the answer there is maybe not healthy for everyone. The problem is it's difficult for us to know, well, am I a responder or non-responder? And so in that case, then I just usually tell people moderation, and everyone should probably consume less of these low-calorie, no-calorie sweeteners. The next question was about added fiber. So yes, 100%, every dietitian will always tell you we'd like to get our nutrients, our fiber, from foods, from whole foods. That is the best way nature gives us this whole complement of all the different nutrients and benefits in the package of a food. But sometimes we extract things out. And so in terms of the fiber, sometimes it's just hard to get all the fiber we need in the day. And so yes, there are products where they've specifically enhanced the fiber with some of these isolated fibers, or some people will take a fiber supplement. So there's a place for those. If we think about the dietary fiber recommendation for women, it's 25 grams per day. But we know that if we want to get benefits for our heart, so cardiovascular benefits, that goes up like be 35 to 45 grams per day. So sometimes that might be hard to get just from food, and so added fibers might be beneficial. And then my memory, okay, today is on the antibiotics and the probiotics. So antibiotics, what we know in terms of the antibiotics, and specifically I'll talk about our gut microbiome, is the most sensitive period of life when antibiotics can affect our gut microbiota, our gut bacteria, is in infancy, so in early life. And that's where we'd really, really like to minimize the use of antibiotics, because some of those effects are very long-lasting for health. So more asthma, more obesity if you have a lot of antibiotic exposure early in life, and even during pregnancy if mom has to take them. In terms of later on in life, so sometimes we get infections, we need to take antibiotics as adults. Our gut microbiota is more resilient, so it tends to come back better in adulthood than it does in infancy. And so, yes, there's things that we could do to help get it back there. Probably the best thing is diet-wise. Eat the fiber to bring those healthy bacteria back. Certainly with probiotics, there's research that shows it can, if you take it at the same time of antibiotics, can reduce antibiotic-associated diarrhea. So a lot of people who take antibiotics get diarrhea, and so it can help reduce that. But there is some work that maybe it delays how fast your gut bacteria come back to a normal state. So probably fiber is the best way to get it all back in shape.
Okay. Wow, good one. Yeah, okay, good one. Any other questions? I was going to say something, but we don't need to hear from me.
Hi, so I have a question.
Where are you?
Here.
Hi.
Okay. So my question is related to PMS. Do you have any advice for GI symptoms related to PMS? Does it have anything to do with gut health? Like me personally, I tend to experience more of the diarrhea side of things, and high fiber doesn't really work well for that. So I was just wondering if you had any advice for that.
PMS, I think any of you could go down this road, right? PMS and nutrition, or PMS and, okay, start there.
I don't have a great answer for that. So, yes, premenstrual syndrome, the gut, you might feel different gut symptoms on that. In terms of the diarrhea, so again, that could be something that could be improved with diet, but nothing is coming to mind.
So really, I think what you're saying is, let's all go with this. Let's go with the approach of setting up our guts for success. And that is going to cut down that unto itself. Taking those steps to fill our gut with what we need is going to take steps on improving the impact of every single thing we've been talking about all day long. Correct? Okay.
Yeah.
Okay. Anybody else? Okay, go ahead. Oh, over here.
Thanks so much for the presentations. They've been great. I have two questions. One for Dr. Reimer. in terms of supplements, I've heard lots of conversations about taking olive oil shots, for example. So can you speak to that? And then I have another question.
Who are you hanging around with that's telling you to take olive oil shots?
I know, right?
I've never heard. Is this a thing?
Yep.
Have you? Really?
Yeah, and some of the health food, they're talking about taking olive oil, like 2 tablespoons of olive oil every day to do some of the anti-inflammatory piece.
Oh.
And then my other question is actually about the adolescent gynecology. I'm also seeing a lot of trend in a lot of the 12-year-olds that I'm working with who have are struggling with mood as they're starting to figure out what menstrual cycles look like. And I'm seeing a lot of trends of putting them on birth control or IUDs right away, right within the first 6 months to a year.
Well, you're not going to find a doctor in anywhere that is going to take a kid off the street and jam an IUD up there. So let's assume that there's been some consultation going on. Let's start here. Your thoughts of birth control, not your thoughts. Birth control, IUD, period symptom management in preteens, we'll call them. There's going to be a process that goes on before we get to that stage of managing those symptoms.
Yeah, so there's definitely a process that happens. So obviously kids need to have their first period, and then we kind of see how the periods are. Some people, they start their periods, they're immediately coming every month, but for about 50% of patients, it can take up to 2 to 5 years before their periods start to regulate. And what we say is around that 5-year mark is kind of what your period is likely to be for the remaining of your reproductive life. Whether to start people on medication really depends on if there's any concern. So lots of kids definitely have some cramping that resolves with taking ibuprofen or some Tylenol. A hot water bottle or heat is a very good, just makes pain much improved because heat and pain are transmitted by the same nerves. And so typically in our clinic, we would only see kids that are really struggling with their period. So they're missing school every month, or their behavior is affecting their relationships for 2 weeks of the month. And so for those kids, we have a discussion about what is the main concern. So if it's bleeding, then we talk about options to either make the period lighter, and we have non-hormonal options as well as hormonal options. And then from the hormonal options, we have the combined estrogen-progesterone option, the progesterone-only option. We have injections. We have like a little implant that goes in the arm, or we have IUDs. And generally in a shared decision-making fashion with the patient, their supports that they come with, as well as us, we come to the best solution for that patient. And for some patients, it is stopping their periods with a birth control pill or an IUD. And the other thing to remember is in our current life, we have way more periods than people ever would have had 150 years ago. Mm-hmm. So when we look back, we know lots of people would have been having children between 14 and 16. They would have been pregnant, breastfeeding, and having children again every 2 years, either until they passed away in childbirth or their period stopped because they got to the age of being in menopause. And so we have so many more periods during our reproductive lives now because of the delay in first birth, which in Canada has gone from 27 about 10 years ago to now being close to 32, 33 for first birth.
Oh, wow. Okay, do you want to address the olive oil shots?
Sure.
When you walk up to the shooter bar, forget the Baileys, hit me with a EVOO.
So one of the most important things we talk about in terms of changing our dietary habits and eating for health is it has to be something sustainable, and you have to enjoy it. So if taking tablespoons of olive oil is not enjoyable, then the better way is to incorporate it into salad dressings and eat it in the context of food and a meal rather than almost as a medicine, even though it's not a medicine, but sustainable and enjoyable because you're more likely to stick with that long term.
Which is really the crux of what we've heard all day, is that if we can start with common sense, then we can continue with common sense. If we start with shooting olive oil and taking cohosh brownies, and and then trying to make up for that by taking a supplement over here that's going to counteract this, that is would seem like, drink water, exercise, eat food, food, and count on that to be the sustaining factor rather than some of the other things. Yeah, boy, the wellness, and God bless them, but the wellness industry has done a bit of a number on adult female consumers because we're getting inundated with all of this. If I thought olive oil shots would make some of my wrinkles go away, I may well take an olive oil shot, but it wouldn't last very long for sure. Okay, so we are moving on to our final part of the program. Ladies, thank you and fantastic. All right. Okay. Who signed up? If you RSVP'd for the documentary, do you want to come down and sit closer to? I don't know what your neck, situation, comfort level is, but if you RSVP'd for the documentary and you would like to come down a little bit closer to the screen, please do. And we just want to make sure that everybody is comfortable. This is going to be the documentary next, and we will have one final short Q&A after this documentary. So come on down, we'll get out of your way, and then we'll get ready for the documentary. Thanks, ladies.